Today's video will talk about the abdominal muscles. So for the anatomy, in addition to talking about the 4 specific abdominal muscles, we'll also talk about the diaphragm and the intercostal muscles. In regards to the massage techniques, we're going to use a lot of our hands instead of the tools that we've done in the past. The reason why is in the abdominal area, underneath the abdominal muscles are the organs and intestines, and we want to be careful with that. So we're going to use our hands and fingers. For the anatomy, we'll go to the computer first and talk about the abdominals, the diaphragm, and the intercostals, and then after that we'll go to 2 textbooks. On the computer here, we'll talk about the abdominal muscles first. So on the top left picture here, it shows Rectus Abdominus, which is the vertical muscle right here, right in the midline that attaches basically from the ribs and the bottom portion of the breastbone all the way down to your pubic bone. Then there's 2 oblique muscles, the external right here, and it was mentioned in the chest muscle video that it blends in with the connective tissue with pectoralis major. You can also see here that it also is very close to serratus anterior. The next layer or deeper layer is the internal oblique muscles here and the transverse abdominis here. Now these 3 muscles all attach to the connective tissue called the aponeurosis that basically engulfs the rectus abdominis. The 2 inner muscles, so the internal oblique and the transverse, wrap around to the back to attach to the thoracolumbar fascia. So we have to think of these as a 3-dimensional muscle. The picture down here, this is the external oblique. Again, it attaches to the ribs and to the fascia or aponeurosis. Here is the internal oblique, which wraps around to the thoracolumbar fascia and to the ribs. And the transverse abdominis, again, attaches to the thoracolumbar fascia, the ribs, and to the aponeurosis at the front part here. On the bottom right picture, it shows the connection to the aponeurosis where rectus abdominis is. So this is the picture of rectus abdominis. Here is the external, internal, and transverse, all of them connecting to the aponeurosis that engulfs the rectus abdominis. Next picture talks about the diaphragm. So here, the diaphragm is located on the inner surface of the rib cage, and it looks like a parachute. And each time you breathe in, this muscle moves downward and makes the thoracic cavity or the rib cage wider to allow more air to come in for the lungs. The picture down below shows the diaphragm above and the transverse abdominis wrapping around. On the top right picture shows the abdominals, and then on the left-hand side here shows the diaphragm. And the bottom right picture shows the diaphragm when you're looking upward. So it looks like a parachute. The next picture talks about muscles in between the ribs called the intercostal muscles. This is also a breathing muscle that helps breathe in and out. So it's located between the ribs again, and there is cardiovascular and nerve bundle here that travel within the muscle. So this is another reason why we have to be careful not using certain instruments to kind of dig into the intercostals, because there might be a risk of damaging the nerve or the cardiovascular. And now we'll move to the book. Now in the book, on the bottom left picture here, this shows the external obliques right here, blending in with pectoralis major as well as continuation with the serratus anterior. So you can see this area could be sticky or gummed up in that area. So we have to work on that. And here's another picture here with serratus anterior and the external obliques. They have this basically the same fiber direction. In the next picture, shows the 4 abdominal muscles. So here's rectus abdominis here, the vertical muscle attaching from the bottom portion of the ribs and the bottom portion of the breastbone area and the ribs, moving all the way down to the pubic bone. And here's external oblique, internal oblique, and transverse abdominis, all attaching to the aponeurosis of the rectus abdominis and then attaching to the ribs. And again, these two muscles wrap around to attach to the thoracolumbar fascia. The next picture shows the diaphragm. Again, it's a parachute shape. It's on the internal surface. And here is an upper view of the diaphragm. Here is the breastbone area. This is the spine, and this is the rib cage here. And then the next muscle is the intercostal muscles right here. So it's in between the ribs, and we're going to use our fingers to treat this muscle. The next picture, or next book, again shows another view of the external oblique attaching to the aponeurosis for the rectus abdominis area, as well as pectoralis major, and then over here is serratus anterior. And when you cut away external oblique, you have the internal oblique, and here is the aponeurosis.